Okay, good morning everyone. Thank you for joining us again. Dr. DeMille will be providing a general update on the evolving COVID-19 situation. Once her speaking notes are done, there will be an opportunity to ask her questions, so we will provide a 15-minute question period. So without further ado, here's Dr. Janet DeMille.
Thank you, Lance. So thank you very much for being here today. As Lance said, I'm Dr. Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit. So I have a few things to talk about today. I do want to start off, though, by noting that we have no confirmed cases of COVID-19 in the Thunder Bay District area, the District Health Unit area, and we have, at the present time, no concrete evidence to indicate that there is community spread of COVID-19 in this area. I will acknowledge, though, that numbers of cases are increasing in Ontario and in Canada more broadly. This is not surprising. A very significant proportion of these increasing cases are from returning travelers who have been on a cruise or coming from other areas of the world, returning back to Canada and being diagnosed with COVID-19. We remain here and in the province and in Canada more broadly in containment mode. As you may recall, that is really about limiting any spread from COVID-19 and overall slowing the spread of this virus in our communities. I also note that since the last time I spoke, significant measures have been put in place both in Ontario, in municipalities across Ontario, and even across the country to achieve the slowing of the spread of the virus. And I will talk a bit more about that shortly. I'm going to focus initially on five areas. I want to talk about the case that was diagnosed over the weekend in northwestern Ontario. I'm going to talk about returning travelers. I'm going to talk about assessment centers and the one that's being opened by the Thunder Bay Regional. I'm going to talk about those broader public health measures and social distancing. And then I'm going to just come back and talk a bit about what we are doing and how we can help you. So I'll begin by talking about the case that you may be aware of that was in a resident of an individual who resides in Fort Frances, who acquired the COVID-19 virus through travel, a cruise ship, and a city in the United States. I think it was New York. So that's a travel-related case. As I indicated before, that's what's happened. Most of the new cases of COVID-19 are travel-related, and this is what we expect to see in northwestern Ontario. People returning from various places of the world, including the United States, who may be bringing back COVID-19. What public health, in this case Northwestern Health Unit, did this weekend, and what we will do when there's a case here, is we follow up immediately on anybody diagnosed with COVID-19. And as I indicated, Northwestern Health Unit did that very quickly this weekend after being informed of the positive results. I was also brought into the loop because of potential implications for Thunder Bay District Health Unit. We are working well together across northwestern Ontario, across northern Ontario, and across the whole province. I will note that it would not be unexpected when somebody is a travel-related case that a traveling companion or somebody else in their particular group might also be diagnosed with COVID-19 in the coming days or the coming weeks. And so what we see sometimes is, for example, a couple, one is diagnosed with COVID-19 and shortly thereafter the other one is, because they may have shared it among each other. So, as I indicated, it would not be surprising that we see more of these travel-related cases here. But these don't mean that there is community spread of the virus. I also want to be transparent with you. There is a family member of the resident of Fort Frances with COVID-19 who is self-isolating here in Thunder Bay. This individual was exposed in a smaller way to the relative and did the responsible thing when she heard about the diagnosis, quickly engaging their employer and public health, and took all the appropriate precautions to ensure no ongoing spread or risk to the population. I want to briefly touch on the fact that there are many rumors circulating on social media, mostly, about cases that are potentially here. We hear about them every day, and whether it's somebody in the ICU or in the emerge or diagnosis. And I just want to let you know that I will tell you when there are cases of COVID-19 in this area. We have a strong connection with the hospital. They inform us when they're doing testing. They will quickly inform us if they have concerns about somebody in their facilities who might have COVID-19. So I'm going to go on to my next point, which is that of returning travelers. One of the biggest risks for us here in Thunder Bay and the district, and even more broadly in northwestern Ontario, is that people who are currently traveling and then returning to this area are potentially bringing COVID-19 back with them. And currently, I strongly recommend that all returning travelers self-isolate for 14 days upon returning to Canada. This means staying at home and not moving around in the community and monitoring for symptoms, among other things. You could find that information on our website. This is my direction. It's also the direction of the Chief Public Health Officer of Canada and the Chief Medical Officer of Health of Ontario. It's very important that returning travelers take responsibility to ensure that they aren't furthering the spread of COVID-19 in this area. If you have symptoms, follow up with public health. We can help you access assessment and testing if it's needed. We are here to help you. I will come back to that in a bit. Now I want to talk about assessment, the COVID-19 Assessment Center that will be open tomorrow at the Thunder Bay Regional Health Sciences Center. It's just off their main building in a parking lot. This is a place where people can be effectively and efficiently assessed and tested if needed for COVID-19. To be referred either through telehealth or the health unit, or if you happen to present at the hospital through their screening process, they might send you over there. It is very important that you don't attend the assessment center if you don't have symptoms. There is a self-assessment tool now available that can be referred, that you can find through the TBDHU website that will help you assess yourself to help you understand whether you need or you may need to be assessed. But I just encourage you to either call telehealth or call us, and don't just show up there. And more details will be coming out on that. The next thing I want to talk about is about social distancing and the broader public health measures that have been put in place. So since I last spoke, which was only a few days ago, we have seen the implementation of significant public health measures. This included the closing of schools for an additional 2 weeks following March break, direction to the colleges and universities, including Confederation College and Lakehead Universities here in Thunder Bay, about moving to online formats to prevent the gathering in classroom settings. We've also seen the limiting of size of gatherings currently set at 250 people. We also see larger organizations like the National Hockey League, the NBA, Hockey Canada making decisions, as well as other organizations making decisions to stop or reduce their programming areas. You will see across the country and across Ontario, municipalities also implementing some public health measures really intended to reduce social interactions among people and slowing the spread of the virus in the community. I recognize that these can be very disruptive measures and can challenge individuals and families. However, they are important, and I would expect to see more of these in the near future. So I'll now talk about some stuff that are more specific to the Thunder Bay District Health Unit. We are here to help you. We are ensuring every day that our website is up to date with current information. Please go there. I'd also encourage you to follow our social media feeds as well. I will note that we are receiving a tremendous number of phone calls. In fact, we have really had significant difficulties keeping up with this. However, we are addressing this issue. We have mobilized our staff across the organization to improve our response to this. We have set up a call center, and we are operating on extended hours in evenings and on the weekend. If you don't get through to us directly, please leave a message with details. We will review these messages and get back to you. I will end by reminding you once again that of the individual measures that we can all take in every single social interaction that we have to reduce the spread of the virus. That includes things like hand hygiene, washing hands, not touching your face, coughing in your sleeve or your arm so you don't spread those germs. I really want, though, today to stress the very significant measure that we could all do to stay home when you are sick. We want to slow the spread of this virus in this community. That will help us all and will help our healthcare system. If you stay home and you're sick, you won't be spreading it to others, and that's a very important measure. So those end my remarks today, so I'd be happy to take any questions.
Is there any cases being listed right now?
Yes. So I don't know how, so I think there was 30, there are currently, I think it's 10 that are out, 10 were tested over the weekend.
There was 32 tests done in our city and region, and 16 of those have resulted negative.
Okay.
But a number of them were just done over the weekends.
Okay, so I'll just do it for this. So there have been 32 tests done in Thunder Bay and the region, and 16 have come back as negative, and we're waiting for the other ones, and 10 were done just over this current weekend.
How many testing kits do you have?
So the testing kits are definitely an issue across the province, and we've been working closely with public health labs and the Health Sciences Centre to ensure that there's adequate there are good testing kits. I don't know the exact number, but we do, both the hospital and public health have some testing kits.
Is it enough though?
Maybe I'll just ask for.
Not
I
sure
think
what to say about that.
yeah.
There could always be more, but we have a sufficient amount at this
Okay.
time.
So we have a sufficient amount at this time.
Can you just talk again, I just missed it earlier, about Fort Francis and how that case isn't so much of a worry here in Greenville?
Yeah, so this is similar to other cases that are travel related. So this is an individual who was traveling and then returned to this area, was actually in Winnipeg visiting some other relatives when this individual became ill and was tested in Winnipeg, and then eventually sent home to Fort Frances. If people do the responsible thing and self-isolate when they come home, and then follow up, like with public health, when they have symptoms, that really minimizes the risk of spread, except maybe to the people that are immediately sort of close contact. So any family members or travel companions that individual was essentially with at that time.
You mentioned travelers should self-isolate for 14 days. Does that include people traveling within Canada?
This is, it doesn't include people traveling within Canada. It includes just anybody coming from outside of Canada, and that does include the United States and Minnesota.
You mentioned the setup that's going to take place at just outside of the hospital. About what's the capacity for that? How many people could be in that building? Because I mean, people are, people may not heed your words when you say don't come if you're not positive.
Yeah. So I fundamentally would encourage people to heed my words. We're working well with the Thunder Bay Regional and with other healthcare partners, and to manage the flow and ensure that the people who need assessment and testing are being able to be assessed and tested efficiently and effectively. Certainly, if people who are coming when they have no symptoms or are just showing up, that will really challenge what we're trying to do, and so I would really encourage people to not go, or to not go to emerge as well. There are different options. People can call telehealth. People can call us. We can help them, and they can use the self-assessment tool that's available online to assess their own risks.
And about the capacity of that testing center?
So I'd have to refer to the Thunder Bay Regional about that level of details. Thanks.
We hear a lot about sort of flattening the curve or containment. Given the measures that are taken now and measures that could be taken in the future, how confident are you that the city or the region could contain the spread to a relatively lower number of people?
So it's such a complicated, evolving situation that it's hard to know. It's hard to sort of predict ahead and see what's going to happen. I am pleased with the measures that have been put in place, and I do expect more to be put in place as we move forward, whether it's from the federally, nationally, from the province, or even locally. And I think it's also about what we do as individuals and what we do as families that are all going to contribute to reducing the spread. And I think if we all work together and do the right thing, we will do well.
So have you made any suggestions, recommendations to any other organizations, maybe businesses, etc., that they should be taking further measures?
So we are in contact with a variety of different organizations in a variety of different sectors, including the municipal sector, which includes the City of Thunder Bay. We've been in touch with like healthcare, social services, and others, and workplaces, and like the Lakehead University and the college, for example, to support them in the measures that they could take. And there was a lot of conversations with the municipality, like Thunder Bay, over this weekend, and I know they will be speaking to that.
I mean, it's possible it comes up today. There's a press conference later on, but a curfew, an isolation period, anything like that, would that be recommended? How much would that help if it is imposed?
So I think there are a number of things that could be done, including closures or reduced mass gatherings. I think what we're looking at, what we at the Health Unit will be looking at, is what measures are appropriate, that will work, that will address this situation.
Any further ones that come to mind that haven't already been implemented?
There's quite a few, and I mean, that need to be discussed, and what's going to work here, because that will be what will matter. And it often is about closures of places, but there's also a downside to those closures that needs to be considered. And so these cannot be done just indiscriminately. They must be done thoughtfully to recognize and mitigate any unintended consequences of implementing those measures.
It's kind of a slippery slope, though. You want to make sure you do your due diligence and, you know, have all those measures done the right way, but the longer we wait, the worse it could possibly get, right?
So I think what you're referring to is that the measures work best when they're implemented before things have started, and that is very much top of the mind about when's the appropriate time to introduce those measures and what are the appropriate measures. The different contexts matter. So particular measures might be used in one area that may not work so well in another. So one has to really approach it thoughtfully and consider the pros and cons and then implement it. I believe we are still in a reasonable window of opportunity right now for Thunder Bay and the region. Now that can change quickly, so we need to be responsive and put those measures in place. But we're not in the place that Ottawa is right now, or the GTA. We're a little behind them in a sense in terms of progress through what's happening.
Well, last week, Mayor Morrow mentioned that our geographic isolation is sort of beneficial to us in these sort of situations. What are also the risks that come with that sort of isolation, particularly for smaller, remote communities, First Nations communities in the NAD territory, Matala communities such as that?
Yeah. So I definitely think our geographical isolation is to our advantage, and I think we should take advantage of it. And I certainly see what we do here in Thunder Bay and the Thunder Bay District as a bit of we're a gateway to the rest of Northwestern Ontario, and we have to consider what that means for us to make sure that because what we do here can also protect others in Northwestern Ontario. I certainly have a concern with respect to First Nations communities in terms of the impact that this can have on them. And I'm feeding into those provincial conversations and those regional conversations about that. I think they too, though, have the advantage of potentially putting in some measures, perhaps related to travel and the travel that goes back and forth, that will help them protect their communities. Okay.
Again, this is one thing that I missed. The number of cases here in Thunder Bay.
There are no confirmed cases of COVID-19 in Thunder Bay. Okay. Thank you very much.